Welcome back to Healtalk, your trusted safe space for understanding the human body. Today we are discussing a topic that affects half of the global population, yet it is still far too often trivialized or misunderstood. Menopause. For generations, menopause has been casually reduced to just a matter of hot flashes. But in clinical practice, the complaints women bring to their doctors are much broader and far more concrete. Exhausted women dealing with irregular cycles, sleep difficulties, severe anxiety, painful sex, and sudden weight gain are what doctors see every single day. In fact, experts note that 80% of women will experience complaints related to menopause at some point in their lives, making it a massive frontline healthcare issue. Today, drawing on insights from Dr. Anne Furquet, a leading gynecologist and obstetrician, we are going to break down the actual stages of menopause, the biggest mistakes doctors and patients make, and the truth about hormone therapy. Our first major lesson is that menopause does not just happen overnight. It is preceded by a transition phase that can be quite lengthy. During this time, menstrual cycles become irregular, periods grow farther apart, and eventually stop entirely. While people used to call this premenopause, the medical community now more accurately refers to it as the menopausal transition. So, when are you officially in menopause? The clinical landmark is actually very simple. When a woman has gone 1 full year without a period, she is considered menopausal. For context, the average age for this to happen is around 51 years old. But here is where a very common and potentially life-altering mistake happens. Many people try to confirm menopause too quickly using a blood test. Because hormone levels fluctuate wildly during this transitional period, a blood test can give you a false sense of reassurance. Dr. Furquet highlighted a shocking case of a 42-year-old patient who was declared menopausal by a doctor, started on hormonal therapy, and later turned out to be pregnant. The message here is crucial. Before the age of 50, and especially at the start of your transition, ovulation can still occur. If your menopause is not completely established, do not stop your birth control prematurely. An immediate rush to medicalize the situation isn't always the right answer. Instead, you and your doctor need to carefully review your cycle timing and symptoms. This brings us to the symptoms. We need to completely broaden the conversation beyond just hot flashes. This period in a woman's life can be accompanied by intense sleep disturbances, unpredictable mood swings, cognitive difficulties, urinary incontinence, increased fat mass, and decreased muscle mass. One specific issue that stands out is the Genitourinary Syndrome of Menopause, or GSM. This includes severe vaginal dryness, burning, pain during intercourse, urinary discomfort, and recurrent cystitis or urinary tract infections. Often, women are too embarrassed to spontaneously report these issues to their doctors, even though they are directly related to menopause. Clinicians need to ask about these symptoms directly and simply to avoid diagnostic uncertainty and unnecessary treatments. If you are experiencing pain or recurrent infections, please do not suffer in silence. Tell your doctor. We also cannot trivialize early menopause, which occurs before age 45. When a woman loses estrogen this early, there are potentially greater consequences for her cardiovascular risk and her bone health. A woman going through menopause at 52 and a woman experiencing early ovarian insufficiency simply cannot be managed in the exact same way. Now let's talk about treatments, specifically menopausal hormone therapy. Despite how common menopausal suffering is, only about 23% of symptomatic patients actually use hormone therapy. Why is it so dramatically underused? It mostly comes down to 2 major fears: the risk of breast cancer and cardiovascular risk. When it comes to treatment, Dr. Furquet advises against making things overly complicated. Transdermal formulations, like gels, patches, and sprays, are often preferred because they avoid first-pass hepatic metabolism in the liver, offering a more favorable absorption into the body. For oral therapies, the goal is to prescribe an estrogen and progestin combination that is as close to natural and physiologic as reasonably possible. But what about those risks? The decision to start therapy always depends on a careful risk-benefit balance. Interestingly, experts point out that everyday lifestyle factors, like a lack of exercise, carrying excess weight, and drinking alcohol, actually have a larger influence on your breast cancer risk than hormone therapy does. To safely navigate these risks, doctors look at 2 concrete criteria. First, they look at your breast density. In patients with low breast density, doctors generally feel comfortable prescribing hormone therapy. By contrast, if your breast density on a mammogram is high, caution is required because hormone therapy might increase that density further and require closer surveillance. The second criteria is your vascular health. Your arteries should be healthy. Initiating hormone therapy too late in life, after dangerous plaques have already formed in the arteries, could actually destabilize those plaques. Furthermore, estrogens carry a somewhat higher thrombotic risk, meaning doctors must pay close attention if you have any history of blood clots, phlebitis, or pulmonary embolisms. The goal is not to trivialize hormone therapy, nor is it to demonize it. The goal is to reserve it for the right patients, at the exact right time, with the appropriate medical precautions. Ultimately, we need to remember that menopause is less of a sudden event and much more of a transitional period that requires careful, compassionate support. There is no single miracle marker. It is about recognizing the symptoms, not rushing to stop contraception too soon, actively screening for genitourinary complaints, and choosing the right treatment strategy tailored specifically to you. Thank you so much for joining us on Healtalk. If you or someone you love is navigating this transition, please share this video with them. Be sure to subscribe for more evidence-based medical insights. Stay healthy, be kind to your body, and we will see you next time.